When it comes to hyperbaric therapy, it's super simple once you get the concepts. And they're really just two. Okay. One is oxygen and one is pressure. Okay. And so we combine these two, increased atmospheric pressure, the second one, with increased inspired oxygen, the first one that I mentioned, to drive more oxygen in circulation up to supraphysiologic levels, up to 1,200% more oxygen in circulation, or even more than that potentially as well.
Today's guest is Dr. Scott Sherr. He's a board-certified internal medicine physician, certified in hyperbaric oxygen therapy, HBOT, and health optimization medicine. He's the founder of Integrative HBOT, a worldwide telemedicine practice where he consults, educates patients, and clinics using his novel approach to hyperbaric therapy that includes cutting-edge and dynamic HBOT protocols, comprehensive laboratory testing, targeted supplementation, personal practices, synergistic technologies, and more. Dr. Scott's titles include founder of Integrative HBOT, co-founder of One Base Health, COO of Health Optimization Medicine USA, and COO of Smarter, Not Harder podcast. Welcome, Scott. So happy to have you. Welcome back to Take Back Your Health. It's Dr. Amy Myers. I am excited for our guest today, Dr. Scott Sherr. We're going to be talking about one of my favorite topics, which is hyperbaric oxygen. And he is a wizard and a pro and an expert in all things hyperbaric oxygen. So welcome, Scott. So happy to have you.
I'm happy to be here, Amy. I'm excited to talk about hyperbaric therapy. It's what I've been doing for a decade. So It's always fun to educate and be here. So
I always like to start with people's stories. So you're educated as an internal medicine physician. Then later or at some point got into hyperbaric. So can you tell us, that journey?
Sure. Yeah. So I'm a board certified internal medicine physician. I trained at the University of Maryland in Baltimore.
I did my residency at the University of Maryland. That's not on your bio. So
that's awesome.
Yeah. I did my residency at shock trauma.
You did a trauma?
ER medicine. Yeah.
Well, no shit. That's crazy because that's where I was introduced to hyperbaric medicine. Was at the Shock Trauma Center in Baltimore. Right. I was there in 2003 to 2007. And
wait a minute, we were literally there like at the same time. I was there 5 to 8. So we overlapped.
I would have been maybe rounding through shock trauma when you were there as an ER doc then.
Wow.
ER, that's crazy. Yeah.
Yeah. So super crazy.
Yeah. So I was a third year medical student and it would have been 2006 then. And I was doing my Q3 call at shock trauma.
Yes.
And I saw people
wearing
coming
pink
in with
scrubs.
Oh yeah. The pink scrubs and everything. Yeah. That's awesome. Yeah.
Those coveted pink scrubs.
Yes,
even the men were like proud to wear these pink scrubs.
I know. And they didn't leave anything to, you saw everything, man. It was the pink scrubs, you saw everything. It was like, they basically see through.
I think they started those pink scrubs because people were taking them and they thought like nobody's going to take them because they're pink. Yeah. And then because no one else had pink scrubs, it identified you as being at shock trauma. So they got taken even that much more because it was if you're walking around town, people knew you were
you
at
worked
shock
there.
trauma.
Like that was cool, right? Yeah, totally. Yeah. So a lot of my friends, obviously, and I in medical school, we all rotated through shock trauma. It was like your Q3 call for 3-week rotation, which people that are listening, that means that you were on call 30 hours every 3 nights, for 3 weeks or something. And I felt like a zombie by the end of it. I think I had 2 days off. And, but in the basement, as you know, there's a large hyperbaric chamber. Mm-hmm. And I remember I was in one of the shock trauma bays, and it was somebody that had been there for several days, but they were in the bay for some reason because they were getting surgeries for neck fasc. They were getting surgeries for necrotizing fasciitis. And this is like a flesh-eating bacteria. And I was talking to the surgeons like, oh, they just came up from the hyperbaric chamber. I'm like, what? What's that? And they were telling me, oh, we have this chamber downstairs that, reoxygenates the tissue. And it usually saves us from doing as many amputations as we would have to in this particular situation. I was like, well, tell me more. And so then I went down and I got a tour. I was like, what the hell is this thing? And it was just kind of like something that happened at that time. And then when I finally finished the shock trauma rotation, I was getting my sleep back and I was like, oh, what was that? And I started doing more research about it. And I learned about how amazing this technology was and how simple really it was and what it could do in an acute setting, but also what it could do in more of a chronic long-term setting, especially in a lot of conditions where, conventional medicine, as you and I both know, falls short dramatically. And as a result of that, I got much more interested in using it in a clinical practice. And then when I finished my internal medicine residency, which I did at the University of Maryland from 2007 to 2010, from there, I moved over to California with my wife, who's also a physician. She's an allergy immunology doc. And I started becoming more interested in hyperbaric medicine. I got involved as a medical director at a hyperbaric facility in San Francisco. And just to take a quick detour back in my life. So I'm the son of a chiropractor. So I'm a pretty strange medical doctor just off the gate or out of the gate because
nobody here will think you're strange.
Oh, I know.
We all love chiropractors.
I know, but having that background
of course
made it very, very important for me because when I went to medical school residency, I was never thinking for very long, at least, about being a radiologist or a gastroenterologist or being a cardiologist. I wanted to get the hell out of Dodge as fast as I could and figure out what I wanted to do with my life, that kind of thing. And so I started off as a medical director at a hyperbaric facility in around 2013 in San Francisco. And then over a decade, I've really created a practice around this amazing technology, but knowing that an integrative approach is so important. So in the sense that if you have an acute issue, these chambers are fantastic. Like you can get into a chamber, you can see amazing things healing very fast from things like strokes and traumatic brain injuries and spinal cord injuries and trauma to a limb or severe infections, burns, like so many things. But if you have a chronic issue, if you have something of long-term goal, oftentimes, and this is what gets me in trouble actually in the hyperbaric community, it's like, please don't go into the chamber right away. Oftentimes, work on optimizing your health first before going in can be dramatically more helpful and successful when you decide to go into a hyperbaric chamber. And so I've been disinvited to hyperbaric conferences because the title of my talk was going to be, please do not put them in the chamber. That doesn't always sit well with people that, sell chambers or that want people to come into their offices. And for me, it's just the context of, I think that everybody can benefit from hyperbaric therapy. It's not an if thing, it's a when thing.
Yeah. Okay. Well, I definitely want to dive into that because, I want to dive into that in just a minute because.
No pun intended. Just kidding.
Right. No pun intended because, there might be certain circumstances where someone can't wait and they do need to get in, such as.
For sure.
Yeah. Why don't you just first start with telling us kind of the basics? What is hyperbarics and, what is it doing for us?
Sure. And that's obviously where we need to start at the very beginning, just like they said in The Sound of Music, right? And when it comes to hyperbaric therapy, it's super simple once you get the concepts. And they're really just two, okay? One is oxygen and one is pressure, okay? And so we combine these two, increased atmospheric pressure, the second one, with increased inspired oxygen, the first one that I mentioned, to drive more oxygen in circulation up to supraphysiologic levels, up to 1,200% more oxygen in circulation, or even more than that potentially as well. And so let's just take these and break them down. So oxygen, most people know what oxygen is and why we need it. There is 21% oxygen in the air that you're breathing at sea level. Over there in Santa Fe, I think you're at altitude too, but here in Colorado where I live, we have about 16% oxygen at 5,000 feet elevation.
I'm at 7,500.
So you have less. You probably have like 15% oxygen in the air that you're breathing. So, but we can maintain our physiologic needs of the amount of oxygen that's required. Again, oxygen is required for us to make energy. If we don't have enough oxygen around, we can't make energy. And so oxygen is typically carried on red blood cells. Red blood cells have this molecule on them called hemoglobin. They have 250 million hemoglobin molecules per red blood cell. Each of these hemoglobins can bind 4 oxygen molecules. So you have 1 billion oxygen molecules per red blood cell that you have. So typically, the amount of oxygen you can carry in the bloodstream is relegated to how many red blood cells that you have. So if you come and hang out with Amy, you come hang out with me, if you're at altitude, you have this hormone that gets secreted in your body called epogen. Epogen, or EPO for short, it's the doping drug. People know it from cycling and Lance Armstrong and lack of one testicle and things like that. And so people know that, but it's a hormone that gets released that increases the capacity of our system to increase the number of red blood cells they have to carry oxygen. So you can increase oxygen carrying capacity by coming to altitude. You can increase oxygen carrying capacity by taking EPO if you want to increase the number of red blood cells in circulation. Or you can give yourself a transfusion of red blood cells right before something like a race. And this is something that's also called doping, right? Because you're increasing the number of oxygen molecules you can carry. But the other way you can increase the amount of oxygen in circulation is by increasing the atmospheric pressure. So if you go and you dive in seawater, for example, if you go down 10, 15 feet, or even just a pool, all the water above you is extremely heavy. You don't feel that because the density of the water, but if you pick up a bucket of water you feel like it's heavy, right? And so it's that heaviness that's in the water that we can simulate in a hyperbaric chamber. And this all comes from diving, by the way. It all comes from diving injury and decompression illness and building of bridges and something called the bends. That's what hyperbaric therapy was designed to treat. But when it comes down to this atmospheric pressure, what that's really doing is driving more oxygen in circulation, not on the red blood cells, because there's very little actually of those sites available after they leave the lungs. If you've checked the pulse ox on your finger, you know that you have like 96%, 100%, even in Santa Fe or Colorado. If you've been living here long enough, that's what it's going to show. There's very few sites on those red blood cells that can carry oxygen any more than you're already doing that wherever you live, if you have normal lungs. Now, what you can do in a chamber, though, is you can saturate the plasma or the liquid of your bloodstream. It's kind of like the salt water of your bloodstream. It helps carry everything. It carries hormones. It carries vitamins, minerals, and nutrients through your system to where they need to go. Some things are bound, of course, but there's a lot of things that are unbound as well in this liquid. And so you have unbound liquid oxygen that can get to places where you can't potentially get red blood cells to unbind it or to let that oxygen go. So the power of hyperbaric therapy is the combination of that increased amount of oxygen, which we can increase up to 100% that you breathe, and that increased atmospheric pressure. Combination driving more oxygen in circulation. And then as a result of that oxygen coming in, you have about 5 or 6 things that are happening immediately. And then over a long term, over a protocol, you have what's called an epigenetic shift or a modification, which is how your DNA is expressing various genes and proteins. It changes because of that oxygen. There's about 8,000 genes that are oxygen sensitive, at least, and then some of them that are pressure sensitive in there too. And that's the shift in epigenetics that you see over longer protocols. So there's the acute oxygen infusion, and then there's the long-term benefits of an oxygen protocol with pressure using hyperbaric therapy.
You have given me the best explanation that I've heard, so I appreciate all of that.
We've done it a couple times.
Yeah. So hey, slightly off topic, but just as we were talking about diving, I have a pool here, and I think it's about 8 feet to the bottom, and my daughter's always diving to the bottom to get stuff. She's like, "Mom, can you dive and get that?" And when I'm at sea level, I have no problem diving down in a deep pool to get something. But here, like the pressure, is there something because I'm at altitude, or is this just maybe I'm getting older and I can't do that anymore? But I don't like to go to the bottom of the pool here in Santa Fe versus at sea level. I didn't know if there was
That's a very interesting question.
Yeah.
So what I would say is that I often get a question that's sort of corollary to that, which is that, well, if I'm at a hyperbaric facility in Santa Fe or in Colorado, and I'm starting off at not sea level pressure, but at 5,000, 7,500 feet, does the pressure work the same way? Do I have to get more pressure to get to the same pressure that you would at sea level? And the answer is no, because it's a relative change, right? So like if you're starting off as I am at 5,000 feet here, and I'm diving down here to, let's say that I'm hypothetically going to 2.0, which is 33 feet of seawater, but it's actually technically not going to be 33 feet of seawater here. It's going to be a little bit less than that. But then the change is about the same anyway. So it doesn't matter is what it comes down to.
Well, that's how you and I met, because I emailed you that exact question.
That's the question. That's right. That's the question you asked me. I was like, why does this sound so familiar?
That's what we talked about. Because I emailed you and then we connected. Yes.
Exactly. That's what it was. And so people worry about that, right? Because the gauge on your chamber is not going to say what you think it's supposed to say, right? So for Amy's chamber, or even for my chamber here, if I have a 1.3 atmosphere chamber at my house, which I know Amy does as well, it's not going to say 1.3. It's going to be like 1.2 something. And that's because I'm at 5,000 feet. But that relative change is the same. Now, why you have more of an issue diving at altitude as opposed to when you dive at sea level, I don't know, because the delta is the same, right?
Maybe it's just I'm getting older. Who knows?
It could be something else. It could be something with your ears. It could be something. There's something else. It could also be the humidity, right? The humidity is different, like when you're in Santa Fe versus when you're at altitude, and the humidity when you're at here in is much less compared to where you'd be in like in Austin, for example, which is like a swamp. So it might just be that there's something having to do. My guess is it's the humidity aspect of things that's maybe causing an issue for you.
Okay. Well, let's. What are some of the benefits? I mean, let's talk, the spectrum, right? I mean, there's like you and I witnessed at shock trauma, there's the very clear medical, conventional medicine indications for hyperbarics, right? Wound healing, strokes, concussions. And then there's sort of perhaps what you and I are using it for. I mean, I was using mine for autoimmunity. I've shared this story before, but I'd gotten a Hyperbarics machine, and it took me a year to finally actually get in it. And then when I did, I got in it every night for a year, and it was because I'd hit a plateau. With my health, I had just been exposed to toxic mold. I overcame all of that, but some of my autoimmune markers were starting to tick up. And I'd changed nothing, but got in my Hyperbarics machine every night for a year, and everything went negative.
Wow.
So,
Okay.
I can speak personally to that. A lot of times I have patients, or had patients that were doing a lot of different things at one time. And so, it was a little bit harder to say, oh, it was the Hyperbarics, it was this, it was that. But
Right.
anyway, there might be people who are doing this for longevity, doing this for, what are some of, I guess, the more conventional reasons that somebody would do this to more off-label, like maybe treating Lyme or,
Sure.
Cancer. You and I were talking about that earlier. My sister, has breast cancer. So just what are some of the off-label usages of hyperbarics as well as conventional?
Yeah, I think the way to kind of dive into this, pun intended this time, is to really try to understand the physiology first. Because when you understand the physiology, and this is what I talk about with patients and clients and clinicians all the time, it's like once you understand the physiology of what's happening, then it makes a whole lot of sense as to what we do. So when you first go into a chamber, what's going to immediately start happening is that you're going to reverse low oxygen states, right? So you're going to have, if you have a hypoxic or ischemic or low oxygen tissue, you're going to be able to reoxygenate that tissue very quickly. And this is what we were talking about with traumatic brain injuries and spinal cord injuries and partial limb amputations and things like that. Heart attacks, you can see if you can reoxygenate the tissue very quickly, you're going to see a downstream effect. You're going to decrease something called reperfusion injury as well, which can be pretty nasty. And so the reversing in the low oxygen happens very quickly, okay? But over the long term over a hyperbaric protocol, not only are you reversing the low oxygen level immediately, you're actually rebuilding blood vessels in tissue that has been damaged. And so that's called angiogenesis, or new blood vessels. And so short-term, immediate reversal of low oxygen states. Long-term, the ability to maintain tissue and recreate tissue and make it robust by new blood vascular beds that can be created in that area. There's also the second thing is immediately there's a decrease in inflammation and swelling. This is very, very important, especially if you have an acute issue, of course. But over the long term, what happens is you have these downregulation of many of the inflammatory mediators that cause chronic inflammation, things like interleukins or your IL-1, IL-6, those kinds of things, your TNF alpha and others. You see a downregulation of all of those. Number three, you also have an enhancement of the immune system in multiple different ways. Initially, the immune system is going to be enhanced by bringing certain types of cells to the area to help clean it up, like your neutrophils, your macrophages, et cetera. But over the long term, it's going to enhance the immune system in various ways. That's going to help modulate it and help you heal much faster, okay? Number four is stem cell release. So immediately you have this amazing amount of exponential stem cell release. And stem cells in the body are ones that help rebuild tissue. They regenerate tissue. They're like the baby cells in our body. And so the stem cells can then mature over time into all the different types of tissue that you can imagine. Anything from a neuron to connective tissue, to hearts, to bone, to liver, you name it, cartilage. There's studies with all of these showing how hyperbaric therapy can help rebuild and regenerate these tissues because of helping these stem cells release and then helping these stem cells mature. You also, I think this is number 5 now. Number 5 is also what you do when you get in a hyperbaric chamber is you're killing bugs. You especially kill bugs that do not like high oxygen environments. And this is oftentimes, in the acute setting, things like neck fash, what we were talking about earlier, shock trauma, but long-term, Lyme is one of those bugs. They do not like high oxygen environments. Mold, MRSA, other types of bugs that do not like high oxygen environments. So you can use hyperbaric therapy, especially at deep pressures. We can talk about the pressure differentials too, but especially at deep pressures to really kill bugs very, very effectively. And the last thing that hyperbaric therapy really does from a physiologic perspective is it optimizes lymphatic and detoxification overall. And so it does this by the pressure itself, pressurizing our blood vessels and our lymphatics to help us with detoxification. And so with all of those things being said, Amy, right? So now you can see that, hyperbaric therapy really is a wound healer from the inside out is what it comes down to. And from a conventional side, you have 14 indications that are currently covered by medical insurance. The biggest one is diabetic foot ulcers. Next after that is if you've had radiation from a cancer, If you have radiation injury that occurs 6 months or later after the radiation, you can see significant benefit using hyperbaric oxygen therapy. Rebuilds the stem cells, the blood vessels, the connective tissue, all that stuff. And so prostate cancer, breast cancer, rectal cancer, head and neck cancers, even brain cancers as well, hyperbaric therapy can be very, very effective there. Also, sudden hearing loss, which is kind of like a neurologic presentation of losing hearing. This actually happened a decent amount during COVID as a sort of a collateral damage from the viral infection. Oftentimes can be viral in nature. Flaps and grafts in plastic surgery, which are used in reconstructive types of surgeries. If they used to use leeches, they still do to help these plastic surgery flaps and things to work, but they also use hyperbaric therapy to prevent these things from not working. And also chronic bone infections, and the rest are more of acute things, but where I spend most of my time, and I know you spend most of your
right? Is that or is that
approved.
it's not approved?
Yeah,
okay,
not approved. So where I spend most of my time, is on the investigational side of hyperbaric therapy, and there's about 50 or so different indications that have very robust data that really give us a sense of the power of hyperbaric therapy to help in a very integrative context too. Because again, if you have a concussion, it's an acute concussion. There's not great data actually right now, research-wise, but like anecdotally, it works really, really well to help people recover from concussions much faster. But you have things like concussion and stroke and Alzheimer's, Parkinson's, and vascular types of dementia. You talked about Lyme disease. Lyme disease and other chronic infections that have an anaerobic or a lack of oxygen component, like often the molds, for example. Also have people that are pre-post surgery that can recover from surgeries faster if they use hyperbaric therapy because it's going to rev up the body's healing processes to work faster. We're also using it in optimal performance. So we're using it for people to reverse their age, because there's some studies that show that hyperbaric therapy can help do that, help reverse markers of aging like senescent cells, which are zombie cells that build up as we get older, and telomere length, and improving blood vascularization to the brain, to the heart, increasing something called your VO2 max, increasing your vascularization to your genital organs. And there's been a study published on erectile function with hyperbaric therapy too. So in essence, if there's a wound or if there's degeneration and inflammation, hyperbaric therapy can be helpful, but is it the right time to come into the chamber? So this is something
well,
that
I definitely want to ask you that. Can I just pause for a quick second before we get into that? So a couple things. So I anecdotally, used it during COVID, which there were a lot of us on a, email chain, physicians saying, intubation was not the right way in hyperbarics, but I've also used it after I thought it was possibly going to get long COVID, and I had a lot of brain fog, got in the hyperbarics and much better, and then have told a lot of people. So I don't, I think that there are some protocols using it with long COVID.
Definitely.
But what I wanted to back up to very quickly, because you mentioned initially about hyperbarics, creating angiogenesis, which is the growth of new blood vessels. And in cancer, angiogenesis is one of the ways in which cancers grow. And so, there is this thought in conventional medicine to not get in a hyperbarics because it could make your cancer grow. Although I've seen plenty of studies, reversing cancer, because then again, if you think of cancer as needing oxygen living, not needing oxygen to live, then hyperoxygenating would kill it. So can you just speak to that quickly when it comes to angiogenesis?
Yeah, so
cancer?
It's an important piece, and I appreciate you bringing it up. There's about 7 or 8 different ways that hyperbaric therapy can be used in cancer. There's only one that's approved, and that's the radiation injury one that I was describing before. But there's about 6 other ways to use it. And they've done lots of studies looking at whether hyperbaric therapy has a pro-growth effect on cancer. And all of them have been negative. And the reason why is what you were alluding to before, just there, Amy, is that cancer grows in a very different way. Yes, it builds new blood vessels, but it does it with hypoxic stress. It does it because cancer mostly grows in a low oxygen environment and causes a dysregulation in a hormone or a compound called HIF, or hypoxic inducible factor, is one of the things it does, amongst other things. And so what cancer does is grow in a disorganized sort of way because it's being stimulated to grow because of low oxygen environment instead of having like a regular stimulus for how blood vessels will grow. So in the 10 years that I've been doing this, I have not seen, over 10 years now that I've been doing this, I have not seen hyperbaric therapy make any cancer grow. Now, do cancers grow even if people get into hyperbaric chambers? Of course they do, right? Because that's what cancer does, right? One thing I have seen, and this is a kind of caveat for people that are thinking about hyperbaric therapy for cancer, is that I don't like people to stop hyperbaric therapy abruptly if they're using it from like a cancer synergistic perspective. Because I have seen in some cases this sort of rebound where cancer will grow faster sometimes after hyperbaric therapy is stopped. This is anecdotal. There's no studies here. This is just something that I've seen with Dr. Nasha's network as well, Dr. Nasha Winters over many years. And so what I will often do is I'm using it for a cancer synergistic reason. What we'll often do is wean people down if we can and not just stop hyperbaric therapy abruptly after like 2 months, especially if they have like a stage 4 cancer or especially if they have a glioblastoma, which is a type of cancer in the brain, which are very aggressive overall. But in essence, it's very safe in the use within the cancer world. We're using it as a way to sensitize people for chemotherapy, for radiation. In the conventional setting, we're using it in combination with other types of oxidative molecules like your IV vitamin C's, your mistletoes, your boswellias, using it with the ketogenic diet. That's all in the Dr. Nasha Winters network of things. And so if somebody comes to me and I do a lot of online remote consulting these days, if somebody comes with an oncologic diagnosis, before they get into a hyperbaric chamber, 9 times out of 10, it's like you need to see an integrative oncologist, understand how hyperbaric therapy is going to be integrated within that ecosystem that you're creating, working on your terrain and working on, other aspects of oncologic care. So that's what sometimes again gets me in trouble because I don't always recommend hyperbaric therapy right away in these kinds of cases, in a lot of cases actually. But so short story, it's very safe with a current cancer diagnosis or a previous cancer diagnosis to use hyperbaric therapy overall.
Yes. And for listeners, I'm going to be interviewing Dr. Nasha Winters here in a couple of weeks. And
Good.
I am enrolled in her cancer as a metabolic disease course right now as well.
Oh, sweet.
So,
That's awesome. Yeah.
So I was just texting her right before this interview about something else.
Yeah.
So I definitely want to hear about all of the things that you recommend you do before you get into hyperbarics, because nobody's really talked about that prior to getting there. One final question is really, can you talk to us about, what we call a hard chamber, and the depths that can go to, and, what that is really used for versus what you and I have, which are these soft chambers at home, and kind of the pros and cons to each of those. And then we'll hop into, your protocol and your thoughts on potentially waiting to get into hyperbarics and doing some other things first.
Yeah. So the way to think about it is, before we talk about the type of chamber, it's just the pressures itself. So when we're talking about hyperbarics, we're talking about things called atmospheres absolute, or ATA. So 1 ATA is sea level, that's 0 feet of seawater. 2 ATA is 33 feet of seawater, or 10 meters for those that are listening that like that system. And then you have 3 ATA, which is 66 feet of seawater. Or otherwise, I think that's, maybe that's 10 meters right there. I'm so bad with meters anyway. So
I think 0, a meter is 3.3 feet or something.
Yeah, so then 10 would be right. And then it'd be 20, 10 and 20. So 0, 10 and 20 meters, and 0, 33 and 66 feet of seawater is kind of like, is 1 ATA, 2 ATA, and 3 ATA respectively. Okay. So that's just nomenclature. Just kind of side thing for just a second is that at 3 ATA, you can saturate so much oxygen in circulation without red blood cells even being involved, that you can maintain physiologic function, at least in animals, at that level. So it just gives you the understanding of the power of how much oxygen you can get in circulation and carry, even if you don't have a lot of red blood cells around. And so this was classically used before we had massive transfusion protocols at shock trauma and other places. You would actually use hyperbaric therapy to temporize people when they had severe hemorrhage, for example. And so just that's a little bit of a side note. So when it comes to pressures, what we think is sort of the sweet spot for the brain and sort of neurocognitive optimization is somewhere between 1.3, which is about 15 feet of seawater, to that 2.0 pressure, 33 feet of seawater. And we think that overall for the rest of the body, outside the central nervous system, we're mostly, the sweet spot is somewhere between 1.7, 1.8 to about 3.0. But from a clinical practice perspective, 1.7, 1.8 to 2.4. So as you can see there is some crossover there, right? And when it comes to the types of chambers that you can do this all in. So there's soft-sided chambers. There's the ones that are made of kind of like a nylon or polyurethane type of material. These will typically go up to about 1.5. There are some chambers that are soft-sided. With some companies, that'll go to 1.7 as well. But usually the soft-sided chamber is usually between 1.3 to 1.5. And then, of course, your medical grade chambers, you have what are called monoplace chambers, so single occupancy chambers that can go from any pressure, any mild pressure to usually about 3.0. And then you have what are called multiplace chambers. And these are chambers that can go to very, very deep pressures, often found in areas where there's going to be a lot of, they're usually in academic facilities. They're also in places where lots of diving is happening because if you have a diving injury at a certain depth, you have to be able to dive back to that depth to fix that injury, the decompression illness. And so what's nice about the multis, as you remember probably from shock trauma, is that you have people that can go inside the chamber as well and be an attendant. So help the person that might be sick or on IVs or intubated or any of those crazy things that Amy and I don't deal with anymore, thank goodness. But so those are different types of chambers. And so the mild units, the 1.3 to 1.5, what I would say to most people are those are for mostly neurocognitive optimization and mostly for sort of day-to-day operations. So a little bit of bangs, bumps, bruises, jet lag, exercise recovery, like a little bit of performance. Like they're not typically used for the indication that you used it for actually, which is for more for infection. Typically, usually, most of the time, I would recommend deeper pressures for autoimmunity and for infection, especially if it's not a neurocognitive presentation. For things like MS, ALS, we will use the mild pressures. But for more for autoimmunity outside the central nervous system, like your lupus, your RA, your Sjogren's, and things like that, I'm typically recommending deeper pressures. But it's a spectrum. And also, what also gets lost in this is that it is for me, it's always about dynamic hyperbaric protocols. Like you often want to start off at milder pressures for people than your goal pressure, and then go down deeper after you're sure that they've tolerated going to the milder pressures first. And just another tidbit here before I break is that the other thing to mention is that some conditions will have a neurologic presentation that's pretty dramatic, but they also have a systemic component as well. As, for example, Lyme disease, right? So Lyme can have like significant neurologic component where you may want to focus on more neurologic pressures initially. And then after several weeks or maybe a month or so, depending on the situation, then you might want to dive down deeper from there to really work on killing the bugs themselves. There's the theoretical risk if that you give the bug just a little bit of oxygen, but not too much, like Lyme, for example, because it's something called the facultative anaerobe, which means that it can live in oxygen rich environments but it prefers the oxygen rich environments, but it can live in anaerobic, so it can live in like low oxygen conditions too. So with Lyme, for example, we worry that if you don't give enough pressure, that you may actually make the bugs grow a little bit as opposed to helping them get eradicated. But that's a theoretical, and I've had people like you, Amy, tell me that they've used mild units and seen significant benefit for things like mold. So again, that's why it's so important to kind of have like an individual understanding of how you're going to approach it.
Yeah, I mean, for me personally, I had recovered from the mold, and I like to check, labs all the time, and so I didn't have any autoimmune markers positive, but I just had them sort of creeping up over normal. And I was able to get them negative. So I was worried about them becoming positive, but they were not positive. I mean, no conventional doctor would have diagnosed me with anything. But even with my Graves' disease, all I ever had was TPO antibodies, and I was able to get those 100% negative. And then, I've later other times been exposed to mold and had like a, ANA just go from, 0 to 1 to 40 and then get in the hyperbarics and get it negative. So I don't have any, I didn't have any positive diagnosis. These were just things creeping up that I wanted to
inflammatory markers is associated with. And that I have seen also at these milder pressures, especially. So because, as we mentioned, hyperbaric therapy is a fantastic anti-inflammatory. In fact, there was a case series that was done on inflammatory bowel disease and showing that using hyperbaric therapy for things like Crohn's and ulcerative colitis with refractory disease was as powerful as giving steroids in some of these patients. Wow. So it can be very, very powerful as an anti-inflammatory in the short term as well. And of course, rebuilding the gut in other ways with new stem cells and everything else that it can do as a result of, what hyperbaric therapy can do.
Well, two things that I want to dive into now, and they both may be long answers, so we can take them obviously one at a time. One is, what are the things, and I imagine it depends on what the person's dealing with, but what are you saying, wait, don't do hyperbarics yet. Let's optimize these things. And then secondly, it sounds like, I'm familiar with the concussion protocol, but, I'm not familiar with just a lot of protocols. And it sounds like maybe you have developed or consulted with various protocols for various, infections to diagnoses. So I'd love to hear about some of those as well.
Yeah. I mean, so what I do is I train clinics all over the world on how to use hyperbaric therapy within the context of the modalities that they have at hand. So whether that's a biohacking clinic that doesn't have practitioners, or if it's a chiropractic neurologist, or if it's an orthopedic surgeon, I mean, a lot of different types of docs are starting to integrate hyperbaric therapy, and then we can talk about those. But when it comes to weighting, the deal is this, okay? If you have a long-term condition, a chronic condition, right, something that's been going on for a long period of time, or if you have a long-term goal, like you want to live longer, right? You want to have your longevity and health span match, right? You want to live longer and you want to be healthy for as long as that you can be. The idea that you can do nothing but just go into a hyperbaric chamber and see benefit is not a good one under most circumstances. So if you came to me, Amy, and said, hey, look, I have, chronic, I have mold exposure, I have Graves' disease, and I haven't seen any practitioners yet. I haven't done anything to work on my health. I haven't started doing anything with my diet, my lifestyle, with things that I'm doing. I'd be like, please do not go into a hyperbaric chamber right now. Like, this is not a good idea, right? Because you want to get some of that foundational stuff working before you start stressing the system with oxygen. So what we didn't talk about is that, when you go into a hyperbaric chamber, we talked about how much oxygen comes into circulation, right? And we talked about what can happen, but why does all of that stuff happen? It happens because two reasons. One, just reversing oxygen levels that are low can be very, very effective, as we talked about with the heart attack, strokes, and things like that. But the other way that hyperbaric therapy works is by creating something called oxidative stress. And what that oxidative stress is so when you make energy, when you make ATP, which is our energy currency, you make energy, you make ATP, you also make carbon dioxide, you make water, but you also make these things called reactive oxygen species, or ROS, or free radicals, or oxidative molecules, or there's other words for this stuff. The body is used to this in small amounts because these are signaling molecules. They tell the system what to do, how to do it. But if you have a flood of these in circulation, then you have a stress on the system. Now, you can have good stress in the system, and you can have bad stress on the system. Oftentimes, it depends on if your body can actually compensate for that stress that's going in, right? So in a hyperbaric chamber, you are creating an oxidative stress. And what the body has to do is respond to that stress. And it responds to that stress by creating a surge in antioxidants, in ways to neutralize that oxidative stress. But that oxidative stress is responsible for decreasing inflammation. It's responsible for creating all those stem cells. It's responsible for killing bugs and in your immune system activation. So it's doing all these positive things. But if you don't have the machinery to, number one, detoxify from those oxidative molecules, you're going to get in trouble. And I've seen this and I've been burned. But even on the beginning of this, do you have the capacity to make energy effectively? And that's the ATP that we're trying to make, right? So if we give you all this oxygen in circulation, do you have the vitamins, the minerals, the nutrients that are required to make energy effectively? And also, can you get this oxygen to where you want it to go? Like, do you want it to go to the brain, right? Do you want it to go to the shoulder or the genital, whatever it might be, right? To make the oxygen work better. So the challenge in the hyperbaric world is that we don't think about these things as much, right? And what I've been trying to do is give a framework and say, yeah, we can get a whole bunch of oxygen in the system. That's great, but can you make energy well? And can you detox from the energy that you've just made? And a lot of our patients, your patients previously, mine still now, they don't come to us with the capacity to do this very, very well because they've been sick for such a long time. They've had long COVID and long haul symptoms for 2 to 3 years. You probably had mitochondrial dysfunction before that and issues making energy detoxification, right? So the big sort of hold up weight thing for me is like, where is somebody right now with their health and how can we optimize their ability to make energy effectively? And how can we optimize their ability to detox well before going in? So that's why when somebody calls me and we have a conversation, like 80 to 90% of what I talk about with people has nothing to do with hyperbaric therapy. The protocols are very easy, and we'll talk about those, right? And because and hyperbaric therapy is easy in the sense that all you need to do really is hang out in a chamber, right? But if you're drinking alcohol 3 days a week and your relationships suck and your wife snores and you can't sleep with her and you're afraid to tell her, but you really need to get a sleep divorce, for example, and sleep in a different bedroom. If you're eating McDonald's 5 times a week, right? There's nothing that hyperbaric therapy is going to do long-term for you for these chronic conditions, right? And I think that's the framework that I like to kind of talk about with people. And then I have a framework that I bring people into when they come see me. I have my own concierge medical practice where I do metabolomic testing, which is looking at metabolism, looking at vitamins, minerals, nutrients, all the things that I was just mentioning, optimizing diet and circadian rhythms and behavior and doing all those things. And then waiting like 3 months, 6 months, sometimes longer, and saying, okay, now that you're able and prepared to mobilize and harness all this oxygen that we're going to be putting in your system, now it's the time to do it.
So let me ask you on a personal level, because, I'm pretty dialed into those things. Yeah. And obviously that's what I would do with my patients initially as well. And then, get them into the hyperbaric chambers. But for somebody like myself, who's pretty optimized in all of those areas, I go through periods where I'm getting in it every night for a couple of months to, I'm traveling and I haven't done it. And, I'm just going to hop in tonight. Is there anything? I don't feel anything from the hyperbaric chamber. I never have. That whole year that I got in every night, I didn't feel a thing, but I saw it in my labs. The only time I've actually ever felt anything was, and mind you, I've only gotten in a hard chamber, I think maybe twice, because I had to go somewhere else. And I'm rather previously claustrophobic. And so, here at home, I like that I can, get in and get out myself. But anyway, long story short, when I had COVID, or when I thought I was having even when I had COVID, I didn't feel anything. But when I had brain fog after I had recovered from COVID or was no longer infectious, I got in and immediately my brain fog went away. But other than that, I am not a person who can normally tell anything from the hyperbaric. Some people get out and they're like, I feel younger. I feel
great.
Energized. I feel, I'll get in it and go to bed. Like that's my thing. I put my child to bed, then I get in and then I go to bed. So back to my question, which is someone who's rather optimized, am I doing damage that I'm, twice this week I got in and next week I didn't get in at all and the next week I got in 5 times?
No, not at all. You're not doing damage. So what it comes down to is that I would never have recommended you go every night for a year. Like that's nothing that I would ever recommend. 5 nights
a week. It was, to be able to do anything every single day, particularly with a child, was very difficult. But in general, I was getting in it,
Yeah, to be clear to those that are listening, I just wouldn't recommend anybody do that. Okay. And because the issue is what I just was describing, which is I worry about oxidative load over time. Now, because of your ability to test things over time, like you were doing, right, and seeing kind of where things were, and also you were relatively well optimized, and also in addition, you were using a milder pressure, right? So you're using the 1.3. That's much safer than doing like 2.0 5 days a week for the rest of your life. And so what you worry about there is you worry about oxidative stress. You worry about your body's ability to be able to counteract the energy that you're making with enough antioxidants to be able to balance that oxidative load that's happening over time. So what I always recommend people do is think about hyperbaric therapy in protocols and maintenance if you're going to be doing maintenance, right? And that's kind of what you're doing right now, right? And protocols is when you're going in, you're 5 days a week for a period of time. And then your maintenance is when you're going in maybe on average, maybe 2-3 times a week, depending on the situation. Maybe you're targeting those maintenance sessions to various things. And this also depends on the type of chamber you have as well. But in essence, the protocols are when you're trying to make big shifts on those epigenetics, right? Those shifts in inflammation and blood vessel growth and stem cell release and things like that. Whereas when you're on the maintenance mode, you're mostly looking for sort of like a 1-off or maybe 2-off for something more acute. So say you just got off an airplane, right? And you're jet lagged. You and I don't get as jet lagged actually as somebody else that comes from sea level because we live at altitude already. Right. When you're on an airplane, I don't know if you've noticed this, but you're
not getting all the oxygen.
Right. So you're on an airplane, you're pressurized to 8,000 feet above sea level. So, Amy lives at 7,500, I live at 5,500. So we're used to being closer to that than if you lived in Austin all the time, or if you live in LA or wherever, you're at sea level there, you're at 21% oxygen. And so as a result, you're going to have more jet lag, but you're also going to be more hypoxic than we would. But the idea of getting to a chamber for a couple of days after you get back from a trip can be gigantic, right? And that you see your brain fog go away, you'll see your energy get a little bit better. You can pair it with a cold tub or like with some sauna, depending on what you got and what you want to do. And so what I do is I create protocols where you're integrating hyperbaric therapy with other tools and technology, supplements and things like that to help, optimize the whole process. So like, how are you optimizing energy production before you're going in? Are you taking some supplements there? Are you going to use some lights? Are you going to, do something else? Or when you get out of the chamber, how are you going to work on detoxification and help with that process, right? So a lot of this depends on obviously the particular protocol, but in essence, what I recommend is like these longer protocols, 5 days a week for more of these shifts in physiology, and then these more one-off kind of day-to-day operations, 3 times a week maintenance, usually in the mild units for these, for your, for exercise recovery, for jet lag, and for performance kinds of gains. So that's the framework that I use. And then of course it's the acute issue versus chronic issue, right? So acute, like a surgery, for example, you can go in 3 to 5 sessions and see significant benefit, as opposed to a more long-term issue like you're dealing with Alzheimer's, dementia. We're not talking about 3 to 5 sessions. We're talking about at least 40 to 60 sessions at a time, and then taking a break and then maybe doing more 6 months to a year later in like a 5-day-a-week kind of protocol. So over the years, I've created many, many protocols depending on the situation, but it's always the same framework. It's usually, most people don't have a chamber at their house, right? So most people are going to a facility to do it. And then so it's usually what is that first protocol going to look like? Is it going to be 3 to 5 to 10 sessions if it's an acute issue? Or is it going to be more like 30 to 40 to 60 sessions if it's more of a chronic issue or more of a long-term goal? And then the pressures change depending on the situation. More neurologic than 1.3 to 1.8 usually, and maybe to 2.0. If it's more of a physiologic systemic issue like full body, then it's usually 1.8 to 2.4. And then the time in the chamber changes too. Like if it's neurologic, it's typically 60 minutes ish. And then if it's a more systemic issue, it's more of like 90 minutes ish. But we're also adding some things called air breaks in there now too, which are another idea, which we can talk about if you like, but basically a way to enhance the processes of what we're trying to do, along with decreasing risk of any toxicity.
Well, that's the Dr. Efraidy that I spoke to. I think he's out of Israel. That's what I was trying. Yeah, I did an interview with him, and that's his protocol, is taking those, getting hypoxic and then getting, over oxygenated. And that was the first I had heard of those types of protocols. Yeah,
they pioneered those. Yeah, I mean, they pioneered the concept, but the air breaks themselves have been around forever. And so the key concept there is to understand is that if you're breathing 100% oxygen at 2 atmospheres, then all of a sudden you stop breathing 100% oxygen, you go to 21% oxygen on a mask. Your body thinks of that as like, oh crap, you just went to altitude. You just changed your oxygen concentration. So it releases the same kinds of molecules or factors in the body that you would if you had just suddenly gone to altitude or like got on an airplane or something like that. So as a result of that, you have a benefit in that capacity.
I was just recently at a clinic with my sister, and they actually had a altitude chamber, so to speak, where you go in and it's just a quick 20 minutes. So I guess it's sort of creating that same stressor on your body to then.
Right, but without being as much of a stress, because you're not actually getting hypoxic, right? You're actually just going back to 21%. So it's a relative hypoxia. It's a delta. It's a change that the body sees there, but you're not putting the body under such significant stress as potentially would be if you went in an altitude chamber and went from 0 to 13,000 feet in 5 seconds, right? We think at least is more stressful for the system as it going from 100% to 21% oxygen in a chamber. But that's still being worked out, because I have a lot of people that are involved in the hypoxic, hypobaric environments. And I think from performance perspective, it's fantastic overall, but I do worry in people that have more chronic inflammation that if it's going to be causing more issues if you're not careful.
Right. And so these protocols that you're speaking of, are these all very individualized? Somebody calls and gets a consult with you, or do you have, generalized protocols that people can purchase or just access on your website? Can you tell us about that?
Yeah. So about 4 years ago now, I started a company called One Base Health. And the reason why I started this company is I was really just frustrated with the education in this world. And I think you've seen this, Amy, too. You'll have people saying, for example, that 1.3 atmosphere chambers can do everything, right? At 1.3, the soft chamber can treat cancer. It can treat, I'm not saying everybody says this in this community at all, but you find this because the argument they often give is that you can do more hyperbaric therapy at 1.3 to equal doing less hyperbaric therapy at a deeper pressure. But the answer is that never can be the case because it's an oxygen tension issue. How much diffusion of oxygen you can get into the system at a certain pressure. Well, 2.4 atmospheres of pressure will never equal 1.3 atmospheres as far as how much oxygen you can get in the system. So just how far the oxygen can go outside the blood vessel, that kind of thing. So I got a little frustrated back then on understanding that I had a conceptual framework here that I thought could be very helpful. And so what One Base Health has really been doing over the last many years is creating an educational platform, which is actually now going to be launching in the next couple months, where we're going to show people how to do things from an integrative context, right? What kind of vitamins, minerals, nutrients, and supplements and technologies and practices and other types of practitioners might be helpful while you're doing this hyperbaric protocol or using these other technologies, light, sauna, cold plunge, things like that. How can you do this in an individual way? Because in the end, I do feel like it's very important to individualize a lot of this stuff because it's really important. What I found is that having more of a dynamic understanding of hyperbaric therapy. So if it's not working at one pressure, you're not seeing the benefits, then change the pressure, right? But you don't change it right away as well. You'll have to wait and kind of see. There's nuances there. But in essence, it's very individualized for me. Somebody like Sherr, for example, and the Ephrati, and his clinic in Israel and the ones in the US, the place called the Villages, everybody gets the same treatment, no matter what. And I don't think that's appropriate for a lot of people, because I do feel like, especially if you have more chronic inflammatory long-term issues, that doing titrations of protocols, starting at milder pressures, then going deeper, sets you up for better success. And also doing some of the groundwork like that you did in your office and that I do, with vitamins, minerals, nutrients, and cofactors, and making sure you can make energy and detox as well. So what I would also say, though, that there are some basic rules that I use for almost everybody as far as protocols go. And those are the ones I've just kind of described, like with neurologic pressures, for systemic pressures, for time in the chamber, for air breaks, for integrating various tools and technologies that's going to enhance hyperbaric therapy, or it's going to help you detox from hyperbaric therapy, for example. So I use a lot of infrared sauna, for example. If people have the option for that, it's a fantastic detox tool after you've created a hormetic stress using hyperbaric therapy, right?
So you recommend hyperbarics, then get in the sauna?
Yeah, exactly. Yeah. Yeah.
I usually do my sauna in the morning because that actually does kind of wake me up, and then I do the hyperbarics at night. But
that's okay too. I mean, if it works for you, that's great. But in general, from a detox perspective, it seems, especially at deeper pressures, the milder pressures is not as important, but especially at deeper pressures, it's better to have the sauna afterwards, I found, because you're gonna cause a hormetic stress in the system, and that's what you're doing in a hyperbaric chamber. Hopefully it's just hormetic and not, like a positive stress and not a negative, right? But that's depending on your antioxidant status, your energy production status, as we mentioned. But afterwards, you are going to make more products of energy metabolism. You're going to have some of that already anyway. So getting into doing infrared could be great. Although I have people do, like, one of my favorite ones is a very simple one with a mild chamber that you have is just 30 minutes in a hyperbaric chamber in a mild unit, and then just immediately into a cold plunge afterwards, or a cold shower. Because what happens is that even after you get out of the chamber, even a mild unit, you still have all that oxygen in circulation for about 15 to 30 minutes. And so when you have all that oxygen in circulation and you're pretty well optimized and you go into cold, you're going to squeeze your mitochondria, you're going to shrink them down, you're going to make them more effectively making energy. So not only are you going to be stimulating the hormones of cold, like your norepinephrine, your dopamine, but you're also going to be capacity increasing your amount of energy you can make in that short period of time. So a very simple one that I'll use is that, but I'll also use things like, we didn't talk about methylene blue.
I was literally going to just ask you about it. So when you were done with this answer, I was going to say, wait, you mentioned that. So do you want to get into that quickly? Tell people what methylene blue is. I think a lot of people have heard of it because it's sort of, taking over the internet right now, but what it is and why you like it and how you use it.
Yeah, I use a ton of it. And the reason why I use a ton of it is because methylene blue has the capacity to help our mitochondria, which are the parts of our cell, to make energy. It helps the mitochondria make energy more effectively, so make ATP. And then it also helps you detoxify at the same time, which is very, very unusual. There's very few things out there in this world that help you make energy and also help you detox. And I can maybe name one, maybe, and that's hydrogen, maybe. But other than that, there's very few things otherwise that do this. And so most people now, about 94% of the United States population has metabolic dysfunction, which means that they can't make energy well. Their mitochondria aren't working as optimally as they could. There's a lot of different reasons for this. Number one reason is actually insulin resistance, but there's also toxins in our environment. There's infections, there's medications. People, I think, know this, but metformin, which is used for diabetes, actually is a complex one, so it destroys part of the mitochondria. The idea there is that it's supposed to help you make new ones that are better. I think the jury's still out on metformin for longevity, but it's a separate conversation. But what methylene blue can do is it can compensate for any area in the mitochondria that's not working. So typically you have these complexes on there that help you make energy. They have these flow of electrons through them. And if that's messed up, even in like small amounts, it could significantly derail your capacity. So people with like chronic autoimmune issues, inflammatory issues, long COVID, they often have a disruption of complex 1 of the 4 that are there. And that's the one that NAD, everybody knows about NAD now these days. That's the other fancy thing. And so what methylene blue can do is it can bypass complex 1 and donate electrons directly to the 3rd complex so that you can help stimulate energy production, even if the mitochondria aren't working very well. So I use a lot of it for this reason. In a lot of my chronic autoimmune.
You use it often. You don't use a lot of it because isn't there the downside that it can also be toxic?
So I use it at low doses. That's important. Yes, I use it at low doses, but I use it
frequently with people, but at low dosages.
Yes, that's
what I wanted to clarify.
Yeah, thank you for the clarification. Yeah, so I use very low doses of it overall. So very low doses of methylene blue are optimizing mitochondria. Okay, but higher doses of it are actually anti-infective, and it's also significant potential for things like rescuing mitochondrial function with ischemic events, and it's actually been studied in traumatic brain injury, stroke, at about 2 milligrams per kilogram, which is a much higher dose than I would recommend on a regular basis. But all my patients have a higher strength methylene blue in their medicine cabinet, just in case they need it, if they have an acute injury or if they have an acute infection. Like my mom had, a tick bite a couple months ago. And so we had her taking 2 milligrams per kilogram of methylene blue using something called TroPlus Blue from one of my companies. And so that was, I have her take 3 of we make these things in troche form, which are these dissolvable lozenges, but you can also swallow them. Long story short, you can use methylene blue at these higher doses and anti-infective more acutely, but in general, I use the lower doses like 4, 8, 16 milligrams, which is much lower dose, which really helps support the mitochondria without causing any issues with potential oxidative stress or potential stress on the system, because actually higher doses of methylene blue can actually have the opposite effect. They can, instead of supporting the mitochondria and improving detoxification, energy production, at very high doses, it actually can cause a significant oxidative load. And it's actually been used in this capacity for things like septic shock, which maybe you learn about it at shock trauma. I mean, it's very rarely used for this, but it's like your last ditch effort. If you can't get somebody to increase their blood pressures, you can give them like 10 milligrams per kilogram of methylene blue, which is extremely high doses, to try to shrink down their blood vessels and cause, and try to improve their blood vasculature. So you're right. I use a lot of it. And then I also use in these protocols, I use a lot of it at low doses. I'll correct myself again. That I'll use it because in combination with near infrared light, because methylene blue and near infrared light synergize together on the mitochondria at this complex 4. It's called cytochrome oxidase, and enhance mitochondrial function. So a lot of my protocols will be methylene blue, wait about 45 minutes, go in front of your red light panel, and then go into your hyperbaric chamber, right? And that's a common one that I'll use personally at my house, but I also use it, in a lot of my patients. And the beautiful thing about methylene blue is that it's very, very safe at these very low doses. But the non-beautiful thing about it is it's a synthetic ingredient. So it's not like it came from nature. It was actually produced in a lab, and it was the first drug that was registered with the FDA back in 1897. So it's—
And what were they using it for back then?
Malaria. They used it for malaria. It was the first drug. It was the first real antimicrobial available. So it was used for urinary tract infections, for fungal infections, for malaria. And it's being used now for some of those things again, because some of the drugs don't work anymore, especially against malaria. But it's a fantastic work. It does work for urinary tract infections. You have to use higher doses. You have to use like the 2 milligrams per kilogram dose for several days, but you can see significant benefit using it at those doses. And so I use it as an antimicrobial, but mostly, so like for Lyme, for Bartonella, there's actually been studies using methylene blue at higher doses specifically for Bartonella, because Bartonella has a what's it called? It has the
spirochete?
No, it's the biofilms. That's the word. So it has the biofilms that build up like in the gut or in other areas. So we have biofilms in our teeth. We have them in our gut. They're normal, but they can be pathologic, and bacteria can hide there. And Bartonella hides in biofilms. And so we've seen benefit with Bartonella. Also seen benefit in something called interstitial cystitis, which I think which chronic urinary pain condition. The bacteria tend to hide in these biofilms in the bladder themselves. So you can use methylene blue as a way to break up those biofilms and use other stuff to help clear out infections as well. So, but for the most part, I use it at low doses for mitochondrial optimization and even on performance as well. I use it for like endurance, and my endurance athletes use it for like these 100-mile races and crazy marathons and things like that, and see benefit.
Nobody should be doing, but guess if you're going to do it, yes, if you're going to do it, you might as well try to optimize yourself.
Yeah, I had a guy that I worked with this year. He shaved off 3 hours of his time at the Leadville race.
3 hours. Wow, that's incredible.
It's a lot because these are 100-mile races, right? These are full day events. And he shaved off 3 hours of his time using high-dose methylene blue every 4 hours as he was running.
Wow.
And that's because methylene blue can act just like oxygen as well. So it can actually be the final acceptor.
And that hasn't become a performance-enhancing drug yet?
Still completely legal.
Yet. All right. All those
it's WADA approved.
Out there listening. Yeah. Okay.
Yeah. So my company, Transcriptions, we make like 2 different strengths, and we make like a lower strength for mitochondrial optimization, and we make a higher strength for more of this like anti-infective capacity. But I use the higher doses also in these crazy people that are doing like these ultra marathons. I'll use like 32 to 50 milligrams every 4 hours and see benefit there.
Awesome. Well, tell us how you've mentioned various companies, and you have an app coming out. Just tell us how everybody can find you and all of your offerings.
Sure. Yeah. Well, thanks for having me. I mean, this has been a lot of fun, and I go in lots of different directions.
Well, and I have a final question for you.
Okay, good. Okay, good.
Yeah.
Perfect. I love it. It's good. So on the hyperbaric side, I do my own consulting with people all over the world. As I mentioned, trying to create hyperbaric protocols using the context that I was also mentioning. It's not just getting into the hyperbaric chamber. It's what are you doing before, during, and after. You can find me there at integrativehbot.com. My company is called One Base Health. One Base Health was created within the context of my practice and looking how to integrate various technologies together. We have new sensor technology. We have an app coming out soon that's going to help you educate yourself and how to integrate all of your tools and technologies and practices together, which I'm very, very excited about. It's been a long time coming. On the methylene blue side of life, I have a company called Transcriptions. It's the letters TRO Scriptions. And this company makes a number of different products that are in a buccal troche form, which is a dissolvable lozenge. Our blue ones, though, are based on methylene blue. You can swallow those if you don't want a blue mouth. That's okay, too. Methylene blue is very highly bioavailable, which means it gets in the system at higher amounts or really high amounts, which is great. And we have one called Just Blue, which is our lower strength, and our Tro Plus Blue is just for professionals. So we have a professional line of products. So if you're interested if you're a professional listening, you can sign up for an account. We have a number of professional line only products, including our Tro Plus Blue. So you can find us at transcriptions.com, as well as at Transcriptions on Instagram. And I'm on Instagram at Dr. Scott Sherr.
Awesome. Well, great. And then the final thing that I like to ask all of my guests is, what are 3 ways you would encourage our listeners to take back their health?
So I love this question. So the first one is, oh God, what is the number one here? There's so many. So I have, the first one is to understand that your brain is connected to your body. Okay. Okay. People forget, like we talked about the mind-body connection, right? But if you're going to change your physiology, you also have to change what's going on up here. Okay. And so a big part of my evolution has been the understanding that if you want to help others, you have to help yourself, right? And helping yourself from a physiologic perspective is great, but also working on your mindset. And for me, that's a lot of, understanding. I'm a big fan of meditation, right? Finding ways to turn off, right? Turning off the brain from the monkey mind and just observing your thoughts and creating space in your day from those thoughts and not attaching to them all the time. So if you can do that, you're going to connect everything together, and you're going to be able to heal, and you're going to be able to optimize, and you're going to feel so much better on a day-to-day basis. So number one is to remember that your brain is connected to your body. Number 2 is to move. And this is another one that I just think is just so important. I don't care what kind of movement anybody does, even just a little bit here and there. Like I shake my leg all day, and that's probably why my metabolic rate is higher. if you just actually just move your calves just every day, there's a muscle in there that doesn't get tired called your soleus muscle. And you can just do that, increase your metabolic rate by like 15%. It's kind of ridiculous. So even just that can be helpful, but moving is really, really important. And I really, really just encourage everybody, just when they can find time to move, please do it. The third thing would be, there's so many things that I could choose here. I think the third thing is to play, to have fun. Because I think most of us, and I get into this like, I love to work. I love the things that I do. And I think, but I have 4 kids. So I'm forced like on a regular basis to get out of my, work brain and like go play something, right? It used to, when my kids were younger, I had to play dolls or, dress up or whatever. Now my kids are older, so we go to do different things, but trying to get out of your head a little bit again and learn how to play more in your life is important.
All right. So we have, remember your mind, but don't take it too seriously, or your mind influences your body, to move as I'm moving my leg right now, and play.
Yeah.
Awesome. And I think you've already mentioned where everybody can find you. So we will put all that in the show notes. And this was an awesome talk. It was really, I think, the most useful one that I've had about hyperbaric. So I really appreciate your time and talking to us today.
I appreciate you having me, Amy. Thanks so much.
I want to thank this week's guests for sharing their time and knowledge. And thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.